I'll admit it. I have the immune system of a 2-year-old child.
I wish this was some fun day off work, but really it was just a sick day.
And when I do get sick, I sometimes need to give my boss a doctor's note.
Damn. Here we go again.
Which, when I then go to the doctor to get this note, I gotta say, feels more performative and not so much me like genuinely seeking out medical advice. Like, you know, don't get me wrong, it's not like I'm faking being sick, but you know, when it's just a cold and I don't want to get my team sick, and the nature of my work is this, right? Being on camera and not being like a total mess for you. Like, maybe I just need rest, right? And not someone with a medical degree to tell me that I just need rest.
We all grow up learning what to do when we have a cold. And we know that we don't need to go seek medical assessment to be told that we have a cold.
I think the practical reality is if somebody says that they're not feeling well, I cannot imagine a doctor is not going to recommend that they stay home for that short period of a time.
So I started digging into the wild world of sick notes, why we need them, why we maybe don't need them. Some provinces, like Ontario, want to move towards banning them.
The Ford government says it will do away with 6-note requirements for employees for short absences.
But what I discovered was that Canada is a real patchwork of ideas on how much good and how much harm comes from having to produce these notes all the time. There's no uniform approach to doctors' notes and not even a real consensus on whether we like them or not. But I did find what might just be the first modern sick note. Let's dive into it. Sick notes really seem to have taken off in the early to mid 20th century as a way of policing absenteeism. Industrialization was really hitting its stride. Workplaces became more structured. We saw the rise of the welfare state, and employers increasingly needed a way to keep their employees in check, keep them productive, and not abusing the system. Enter the sick note. This one dates back to 1948. We found it in a book all about the birth of the sick note and the welfare state. And look at this. I certify that I have examined you on the undermentioned date and that in my opinion, you were incapable of work at the time of that examination by reason of blank. Signed, your doctor. Not much has changed, huh? And at first, according to the author, there didn't actually seem to be too much of a problem with this system of verifying whether an employee was truly sick. But fast forward 75 years, and we have a critical shortage of family doctors. And doctors' notes became a problem.
The administrative burden associated with being a primary care doctor has grown. This takes away the time that I and my colleagues have to care for our patients.
The Ontario Medical Association figures the burden of unnecessary administration takes up about 19 hours a week for a family doctor. About 4 of those hours are spent writing sick notes and completing government forms. That means less time for patients and fewer patients that each doctor can take. Across Ontario, it's estimated about 2.3 million people don't have a family doctor. And within 2 years, that could nearly double to almost 4.5 million people without a family doctor. And don't think that this is just an Ontario thing. The numbers are actually far worse in Quebec. One survey of nearly 10,000 people across Canada found 31% of Quebecers saying they don't have a family doctor. Across the prairies, it was 16%. BC, 27%. And the bottom line, more than 1 in 5 Canadians don't have this kind of primary care access.
Family doctor's really important for helping young families decide if they want to have kids. There's a lot of preventative and prenatal care, a lot of care of newborns, vaccinations, prevention. So like just the foundation of life really depends on access to family medicine. Then chronic illnesses do pop up, and family doctors have unbelievable expertise in managing many things at once. And then family doctors are very involved in end-of-life care. So it is cradle to grave.
Some doctors even worry the paperwork involved actually keeps some med school students away from family medicine. The president of the Ontario Medical Association saying no one goes to school to fill out forms. the official position of the Canadian Association of Emergency Physicians, that sick notes put an unnecessary strain on patients, the emergency department, and threatens to spread communicable diseases in our community. They've argued for a ban on sick note requirements from employers and schools.
I think it benefits patients perhaps even more than physicians in a way, because the amount of hassle and time and logistics patients would have to engineer for a very straightforward note after a short illness was quite ridiculous. I've been sort of describing it as a welcome morsel. It's a lot better than nothing.
And some doctors feel really strongly about this. One prominent voice in the crusade against doctors' notes put it this way: employers, the public health system is not your HR police. Sick leave and doctor's notes fall under employment standards law. That's a labor issue, which makes it a provincial issue, which means there are like a dozen different systems for dealing with this in Canada. The doctor I quoted just a moment ago, her name's Kay Dingwell.
I work full-time as an emergency room physician at Prince County Hospital in Summerside, a beleaguered but beloved place.
She was actually invited to speak to lawmakers in PEI to make the case in the legislature that doctor's notes take up a lot of time.
It is a regular event that we have people coming in who do not feel that they need medical assessment for their minor illness, but are presenting to the emergency department for the only reason that they need a work note for a day off work because they have a cold.
And at the risk of stating the obvious, when it comes to small things like colds, doctors say, look, we don't have some kind of cold detecting magic radar. We're just taking what the patient says at face value.
We are listening to them tell us what's wrong. We are saying, okay, you're sick, you shouldn't go to work today, and we're writing that down. A medical certificate for a sick day is nothing more than a confirmation of the request being made.
So you know what happened? Dr. Dingwell gave this big, grand speech in the province that Statistics Canada actually says is the worst in the country for access to a family doctor. At one point, MLAs were like banging the table.
My job is to take care of the person in front of me. It is not to police their attendance for their employer. And it is... Thank you.
And after all that, the bill introduced to eliminate the requirement for doctor's notes for sick employees, so to get rid of sick notes, it was voted down just this month. The bill died. The rationale for killing it from the Premier: we just don't want sick leave to be abused, so there needs to be some kind of system in place.
I think this is part of a continued battle between employers and employees, employer rights and employee entitlements.
The politics and the narratives in each province turn out to be very different.
Now, obviously, you're never going to find hard data on how often people fake being sick. It's a hidden issue, right? By design. But we can get close. I remember seeing one Angus Reid survey a while ago about how an extraordinary number of Canadians admit to having faked an illness at some point to get out of work. So, PEI's Premier argues, there is a problem that needs policing. And employers would certainly argue a doctor can do more than just check a box. They might also estimate how long the employee might be sick. And sometimes, they might actually diagnose a more serious illness that does need their attention. But Ontario is one of these provinces that seems to have decided on the balance of things, it's just not worth it. The Doug Ford government is planning to introduce a law in the coming weeks to forbid this requirement for doctor's notes, with the caveat being, and this is just from government sources speaking to CBC, the law hasn't been written yet, it would apply only to a certain kind of sick leave. So specifically, the 3 days of unpaid sick leave that all employees in this province are legally entitled to.
You have, under the Employment Standards Act, 3 unpaid sick days that you can take, and they're job protected.
So if I use one of my 3 job-protected sick leave days a year, my boss can't ask me for a doctor's note. I might still have to, attest in writing that I'm sick, or maybe even provide a receipt for cold meds that I bought, but no doctor's note, at least not for those 3 job-protected sick days. Then there's Nova Scotia. In 2023, new rules came into effect, making it so employers could only legally ask for a doctor's note if the employee was sick for more than 5 consecutive workdays, or in certain cases of there being multiple absences in a given period. That's pretty progressive for Canada. But bottom line, some provinces have decided that doctor's notes do more harm than good, while others argue they're just about keeping people accountable. Meanwhile, I can go to any number of websites where the specific sales pitch isn't for quick and easy medical care, it's for quick and easy doctor's notes. Doctor's notes have become a business model.
It's back to that incredible juggling and problem-solving act that folks without family doctors have to engage in. So it's not surprising services are popping up to address that need.
So is Canada any closer to just banning the need for a doctor's note altogether? We'll give the good doctor the final word.
That would make a lot of sense to me if we just look at how many days in the year the average Canadian's going to have a viral infection. Why not just say, first 10 days are free? The prove to me you were sick note isn't optimal, I don't think, for patients or for family physicians.